Hi there. I recently underwent a cardiac ablation procedure for atrial fibrillation. It's been 4 days now. I will tell you that I'm feeling as if I'm recovering pretty well. I've got some pain in my hips from where they inserted the catheters on both sides, but I really have no pain in my chest or any other discomfort whatsoever, except for what feels like a pulled muscle. Here's what I can tell you about the procedure. I was definitely making myself nervous prior to doing it. I went online, did some research, looked to see what other sorts of videos were out there that might help put me at ease. I found some information, some statistics, but ultimately I was still pretty nervous about the procedure itself. I wasn't sure if I'd be knocked out entirely, if I'd be awake during the procedure, whether I'd feel anything, so I really didn't know exactly how that was all going to play out. Here's what I can tell you. If I had to undergo the procedure again, I would do so in a heartbeat, no pun intended. The procedure itself was not uncomfortable, wasn't painful, I didn't have any hurt. I will tell you it's definitely a weird experience. I vaguely came to a couple of times while I was undergoing the procedure, didn't feel any pain, didn't feel any discomfort, was not aware that there were any sorts of catheters inserted into my legs or up into my heart or anything like that. There is a part of the procedure that I came to for which was a little bit unsettling, but only because I really wasn't prepared for it. It's my understanding that when they're doing the cryo-ablation procedure, and I had a cryo-ablation as opposed to a heat ablation, the only difference is they freeze the tissue that's causing the problems instead of burning it or cauterizing it. But there's a section of your heart or an area of your heart which is, from what I understand, very close to your phrenic nerve. That's the nerve that controls your breathing. So if I understand this part of the procedure correctly, while they're in that area and taking measurements and looking to see what the problem is, they actually will electronically stimulate that nerve. It's rhythmic, it pulses a couple of times, maybe once or twice a second. It feels like hiccups. And I came to a little bit during that part of the procedure, and right away I was cognizant of the fact that that wasn't my heart at all. It didn't hurt, there was no pain, there was no discomfort. But it was a strange feeling as my diaphragm was basically rhythmically contracting. At the point where they realized I was kind of starting to come to a back, they gave me a little bit more medication, and I was basically out. What I do remember about the procedure is really not much. I remember finally coming to. In my mind, it didn't seem like that long at all, but apparently 2.5 to 3 hours had gone by. I woke up to, I presume, two nurses basically pushing down pretty hard on both my left hip and my right hip. Apparently they were applying pressure at the catheter sites where the catheters had been inserted. I had a catheter inserted, two actually, I believe, on my left side, one into the vein, one into the artery, and on my right side was actually the ablation catheter itself, which what I understand is a little bit bigger, and that one went in through the vein. Again, I wasn't aware when those were inserted, but those points were definitely sore for the next day, 2, 3. I'm on day 4 right now, and the soreness is really just starting to fade now. I do feel like I pulled a muscle in my right side, kind of my lower rib cage area. From what I can tell, I either attribute that to just, being on the, lack of a better word, the operating room table so long in an uncomfortable position, or more likely because when they were electronically stimulating my diaphragm, and that muscle was fluctuating back and forth, that I probably pulled a muscle somewhere in there as well. That's really what it feels like. I haven't had a lot of pain. In fact, I've had almost no pain other than in my hip area. The site where they inserted the cryo-ablation catheter was definitely much more sore than the left side. I'm assuming it was because not only was the catheter bigger, but the vessel leaked a little bit afterwards, and I actually got some swelling there. I had a nurse come in the first night. They did keep me overnight. Come in a couple of times during the night and basically push down on it to apply additional pressure to it to get it to kind of stop. But other than that, I really am surprised that I do not have any pain, any discomfort. I'm not even aware of the fact that I really had any sort of procedure done. I have noticed that I'm not so much short of breath, but the first night, if I went to take a really deep breath, I'd feel a little bit of pressure or discomfort. And I also noticed that after I ate, I definitely had an appetite. There was no issue there. In fact, I had my appendix out about 20 years ago, and I would undergo another ablation procedure before I would choose to get my appendix removed. It's my understanding that roughly about a third of patients who undergo an ablation procedure often have to undergo a second one as well to locate any smaller areas that might have been missed during the first part. If you have atrial fibrillation and medication has not worked, and my understanding is that medication only works for a small percentage of people, I would definitely ask you to consider an ablation. Of course, you need to consult with your physician, and you need to realize you are going to make a decision, that's affecting or could affect the rest of your life. The odds are roughly about 1 in 1,000, probably a little bit less, but if you look online, you'll find odds of about 1 in 1,000 of something bad happening. That something bad could be a stroke, or worse, it could be death. They could puncture your esophagus or damage some other tissue during the process. But if your doctors are skilled, they've done it before, they have the right equipment, and they're taking their time, you should have no problems whatsoever. I tried to put that 1 in 1,000 odds of something bad going wrong into perspective. And the way I was able to do it was to think about how many other times throughout your life you put your life in somebody else's hands, often without even realizing it. Whether you're riding on an airplane, whether you're a passenger in a car, or even if you're driving your own car, whether it's to school or work, you don't even think twice about jumping in a vehicle, going to the store, going to school, going to work. What you often don't think about or realize, probably because you are driving and you feel like you've got some control, you don't realize just how little control you have. You have no control whatsoever over the drivers and the vehicles coming towards you. You're on a 2-lane road, going anywhere 30 to 55 miles per hour. Those other vehicles are going to be coming basically almost head-on, passing within only a few feet of your own vehicle, and you don't know whether that other driver is paying attention, whether they're distracted, whether they might be suicidal, whether they might be drunk, whether they might be on medication, whether they might be texting, whether they might be eating, whether they might be digging for CDs, whether they might be changing a radio station. You have no control over that, but you don't think twice about it. If you put that in the same perspective as being in the catheterization lab when you're undergoing an ablation procedure, of all the places you could be, you are definitely much safer in that cath lab than you are on the roadways in your own town or state. But there's always the possibility that something could go wrong either during or after the procedure. But I will tell you, again, of all the places you could be when there's an issue going on with your heart, that lab is probably the safest place you can be. One of the concerns with atrial fibrillation is when the top chambers of your heart are not constricting like they're supposed to, but are actually fluttering or not properly squeezing, the blood can actually begin to pool up inside your atria, which are your top chambers. And if it pools up and begins to coagulate, you could actually throw a blood clot and have a stroke. So it's not uncommon to be prescribed blood thinners when you have atrial fibrillation, and I believe they also prescribe them after an ablation procedure, just in case there are any hints of the ablation or any hints of the blood clot itself, or any blood clots for that matter. They just want to make sure that that's being eliminated as much as possible. 4 days have gone by so far. I've not felt any palpitations, at least not that I can say were significant. I don't have any sort of monitor on right now, so I don't know for a fact if that's the case and I'm having any palpitations or not. I can definitely tell you that I feel as if I'm better, but it's a little bit too early to tell. And again, my other concern is that oftentimes, at least according to my cardiologist, patients who undergo an ablation procedure, roughly a third of them may need a second one. And I guess the difficulty, especially with A-fib, is even though they know where the majority of those extra impulses come from, strangely enough, they don't come from the actual top chambers of the heart itself. They come from the pulmonary veins, which are the 2 or 3 veins that connect right into those atria. Apparently they generate or manifest themselves right inside of those areas. So what they do with the ablation procedure is they either cauterize or freeze an area around where those veins come in. And I've explained it to people like this. If you pictured a milk jug as being one of the chambers of your heart with 2 tubes sticking in the side of it, if you were to put your head inside that milk jug and look at where those 2 tubes were, if you drew an oval right around it, that's basically what they're trying to do with the ablation procedure, either by burning, ablating, or freezing. They're trying to create lesions or scars within the heart that, even though the physical connection is still there, the electrical impulses, if those continue to generate, will be blocked and not make it through the rest of the heart and thus put you into A-fib. So that's the thought or the underlying process behind it. Again, I would tell you that you know all this already if you've got A-fib and you're looking at it. I do not regret undergoing the procedure at all. I'm definitely black and blue. I've got some definitely ugly marks down in my hip and groin area. I won't bother showing them to you, but to quote a line from Vegas Vacation, I haven't seen a beating like that since somebody put a banana in my pants and turned a monkey loose. It's definitely sore, definitely not pretty. It looks like basically black eyes, but in both corners of my hip. Again, that was from the blood vessels leaking a little bit when they inserted the catheters so that they were able then to insert the catheters themselves inside. I would definitely undergo it again. I hope I don't have to, but time will tell. If I can put you at ease, here's what I can tell you. Again, I have very little recollection of the procedure itself. Wasn't deep sedation, so I didn't have to worry about not coming out of the anesthesia. But I wasn't cognizant, I wasn't in pain, I wasn't experiencing any discomfort. The 1 or 2 times that I can vaguely recall starting to come out of the medication, I had a nurse, I assumed, to my left. They would be aware of the fact that I was coming out of it. In fact, they put some kind of sensors on my forehead just as I was going under. What they explained to me, as I recall, is that they felt like adhesive, but the sensor part itself almost felt like the prickly part of a piece of Velcro. So I felt 2 or 3 of those, and I'm going to assume that when you start to come to and open your eyes, the muscles in your forehead would start to twitch. These sensors would pick that up. They'd realize you're starting to come to. At least that's my layman's guess as to how it would work. But anyway, I hope this reassures you that ablation, even though you're going to be scared, you're putting your life in somebody else's hands. There's always the possibility of something going wrong. In the long run, the odds are probably more dangerous for you driving your car to work or driving your car going to school, but you don't even think about that. So if you are a candidate for the procedure and you're scared, I hope this puts your mind at ease. I can tell you, like I said, I would much rather go through an ablation procedure again than I would having my appendix out. Not that it wasn't without pain or discomfort, but it was all post-procedure. And again, I attribute most of my pain or my discomfort to the bruising on my hips from where they pushed down to keep the pressure on it, and a little bit of the swelling that I had on one side that went down basically after the first day. So hopefully that helps. If I have additional issues or unfortunately have to undergo a second one, I may post again. But I wish you the best of luck, and I hope this puts your mind at ease. If you're a candidate to do it, and it will, in your cardiologist view, definitely improve your quality of life, especially if you're a person who's experiencing shortness of breath or you're getting winded because of your A-fib. Knock on wood, I didn't have any of those issues, but I could tell that it was probably going to get worse and not better. First I thought it was diet, first I thought it was medication or something I was taking. I looked into supplements, whether it was magnesium or potassium or calcium, thinking that was going to have an effect, and none of it had any effect whatsoever. Just for whatever reason, those little areas in your heart decide that they're going to start generating their own impulse. So again, if it's affecting your quality of life, please consider the ablation procedure. Again, it's not for everybody. Talk to your doctor, but I'm not displeased so far. Time will tell, and I wish you the best of luck.